Welcome to Doctors on Call. I'm Jenna Miller. Good dental or oral care is important to maintaining healthy teeth, gums, and tongue. Oral problems including bad breath, dry mouth, canker or cold sores, or tooth decay can all be treatable with proper diagnosis and care. Common oral problems have been linked to other illnesses such as heart disease, stroke, diabetes, premature birth, osteoporosis, and even Alzheimer's disease. Yet for many patients, visiting the dentist remains a stressful and anxiety-filled appointment. Today on Doctors on Call, we'll learn more about dental health and how it's important in preserving your overall health with Dr. Dan Winter and Dr. Eric Johnson.
Presentation of Doctors on Call is made possible in part by an underwriting grant from Kansas Medical Mutual Insurance Company, developing and offering insurance protection and services for the medical community in Kansas. Working with Kansas Medical Society, Kansas Hospital Association, and local communities, PLANCO supports the practice of medicine.
Blue Cross and Blue Shield of Kansas serves more than 870,000 Kansans in various programs. Value Kansans Trust. Blue Cross and Blue Shield of Kansas, and licensee of the Blue Cross and Blue Shield.
Welcome back to Doctors on Call. Our topic tonight is dental health with Dr. Dan Winter and Dr. Eric Johnson. Dr. Dan Winter received his dental degree from the University of Colorado and completed a general practice residency at Charity Hospital of New Orleans in conjunction with Louisiana State University School of Dentistry. Dr. Winter has been awarded fellow status in the following: the American Board of Dental Sleep Medicine, the Academy of Clinical Sleep Disorders Disciplines, the American Association of Hospital Dentists, the Academy of General Dentistry, and the American Academy of Forensic Sciences. Dr. Winter has a general dental practice in Manhattan and maintains active staff privileges at Mercy Regional Health Center. He also is the founder and director of the Center for Dental Sleep Medicine located in Manhattan. Dr. Eric Johnson received his dental degree from the University of Missouri Kansas City School of Dentistry. His practice is located within Gage Dental Group in Topeka and is a member of the American Dental Association, Kansas Dental Association, Topeka District Dental Society, and Heartland Dental. Dr. Johnson is also the founder and guitarist of the charity band The Rock Docs, whose live performances benefit various charities. Give us a call at 1-800-337-4788 toll-free with your medical questions about dental and oral health on Doctors on Call. Our show brings you information which may be useful to you when you visit your own physician. Let's go ahead and get started with some questions of our own while we wait for those first calls to come in. First of all, let's talk about what someone should look for when selecting a dentist.
We usually tell people when they look to select a dentist to utilize the old-fashioned word of mouth. We feel like word of mouth is really the best way to find your dentist. There are many different avenues, especially with the internet today, of finding a dentist, but it's been our experience with our practice that patients that select their dentist through word of mouth are usually patients that understand the value of the relationship with the dentist, and we feel like that's the most important way to find a dentist.
When in the opening we mentioned that sometimes it's kind of thinking about going to the dentist can be stressful or anxiety-filled. What would you tell a patient to calm their fears?
Most of the time when patients are nervous or anxious about care, it's usually a fear of not knowing what's going on or why it's going to happen. And so, though there's a variety of different sedation methods available to make patients more comfortable, one of the best and first steps is keeping them informed and empowering them through knowledge so they can understand what's going to happen and why. And if they can get a feel for, what direction we're moving, why we're moving there, and the way it's going to feel, what to expect, a lot of times that puts them at ease, and that's usually the best first step.
Okay, what are some common mistakes that are made when a person is brushing their teeth?
We usually, when we have our patients brush their teeth or check with the hygienist, a lot of times we'll use a disclosing solution, and when we disclose, we look for areas of plaque, and it's been our experience that although patients can be very efficient when brushing their teeth, they'll have a tendency to miss the same areas. So the most common mistakes are probably involved with brushing your teeth repetition every night, every morning, missing the same spots. So it's important that the patients have a very close relationship with their hygienist to be able to identify those spots and thus increase their efficiency and efficacy of brushing their teeth.
Okay, and what types of toothpaste are the most effective? You know, I think a big thing right now is the non-fluoridated the more natural toothpaste. What is your opinions on that?
Best toothpaste to look for is probably one with the ADA seal of approval. It probably is going to be fluoridated, and when we're trying to fight tooth decay, fight plaque formation, we do want that fluoride in our toothpaste. There are some patients who aren't going to form tooth decay because of their high host resistance, but the majority of patients do need that fluoride exposure. There's all kinds of whitening toothpaste, toothpaste for sensitivity, and so we recommend our patients find one with the ADA seal of approval on it, find one you like and will use twice a day, and it'll work well for you.
Now, do you find that because I think the whitening toothpaste are the big thing right now, are they very effective?
They can certainly help. The most important thing that Dr. Johnson's talking about is really the use of the toothpaste. We agree that if it's approved, it's been by the American Dental Association, it's been through rigorous testing. The whitening toothpastes are certainly okay. They certainly can help with whitening, but you know, the bottom line is the most effective toothpaste is the one that the patient's going to use consistently, use often, which means they're going to brush their teeth and deplaque their teeth. So all those things come into play. If they like a paste or a gel or a whitening or a non-whitening, it's really patient preference. And of course, it's a huge market thing now. You just walk into any local department store and there's a row of dental appliance or devices and brushes. So really, it's patient preference.
What about flossing? How important is that?
You only need to floss teeth you want to keep. That's a common saying, I'm sure you say quite a bit. There's bad bacteria that can grow between the teeth, and whether it's the stomach, the mouth, anywhere else in the body, there's good bacteria and there's bad bacteria. Those bad bacteria are anaerobic, and we want to oxidize that area between the teeth. So flossing is important. If you can't do it with your fingers, flossing forks, a water pick, whatever's necessary to disturb those colonies of bugs between the teeth and make it an environment they don't like to grow in.
And what about, how old should a person be maybe when they start flossing? Should you start your children young?
Oh, without question. We tell our parents to, as soon as those teeth are in, as soon as they make contact, go ahead and start flossing. One of the challenges we find with our adult population, a lot of people are resistant to flossing, especially flossing on a regular basis. We feel like we imprint our kids with good personal hygiene habits, including flossing their teeth. Those teeth start coming in by the age of 2 years old. They're all in. They're contacting each other. You can brush your teeth on the outside and inside surfaces, but the only way to effectively debride or deplaque the surfaces between the teeth is to use dental floss. So you really can't start too early to start working with your kids about getting them flossing those teeth.
And what about, speaking of children, when should a child first see a dentist?
Ideally, that's at first sight of a tooth or before the age of 1. And that's a good time to get the child introduced to being in a dental chair, talking to the parent about their diet at home, scanning for any abnormalities in the mouth, any eruption pathologies, really just getting the parent dialed into things that need to be done at home. If we can prevent a problem at a young age, it can hopefully lay the groundwork for good experiences in the dental chair as the child gets older.
Okay, and let's talk about what sealants are and who should get them.
Sealants are basically they're a plastic, and what this plastic does, the dentist prepares the tooth, etches the tooth, roughens up the tooth, and the sealants flow into the grooves and the pits and the fissures within the biting surface of the tooth. And what this effectively does is it basically eliminates a niche or an environment where the plaque can get in and get settled in. In other words, if that niche or that groove is wider than the width of one bristle of one toothbrush, patient can effectively debride that area. So if we can effectively clear that out and eliminate that niche, then we can prevent decay. It's a proactive preventive effort to eliminate the presence of decay on the biting surface of the teeth. You can place them on any tooth you want. They work better on permanent teeth or secondary teeth than they do primary teeth, but I've seen them placed on primary teeth, and they need not only be on particular molar teeth. We can place them on bicuspids. We can place them on the inside pits of upper lateral incisors. Anywhere there's a pit, that's an environment where the decay can start. That's where we like to see them.
All right, well, we want to remind you that our topic tonight is dentistry with Dr. Dan Winter and Dr. Eric Johnson. So if you have a call or a question for our doctors, you can give us a call at 1-800-337-4788. Let's move on to sleep apnea and if snoring and sleep apnea can be treated by a dentist.
Oh, without question, snoring and sleep apnea can be treated by a dentist. Snoring is believed to be a precursor or a lead-in to more advanced sleep disordered breathing, the most common being obstructive sleep apnea. The sleep apnea is almost 80–85% undiagnosed. Upwards of anywhere from 2 to 5% of the population between the ages of 30 and 60 have some sort of sleep disordered breathing, obstructive sleep apnea being the most common. The problem with it is that when one has an obstruction and has an apneic event, by definition, an apneic event means you stop breathing. And so if we have an apneic event, that can happen. But if it happens over 5 times an hour, all night long, it can affect the sleep architecture, the way one sleeps. And so then there are many, many different ongoing health issues as a result of that. Can it be treated by the dentist? Absolutely. The dentist can place and utilize a oral appliance, and an oral appliance positions the mandible in a position that maintains a more patent or open airway. It splints the airway, thus allowing a better oxygenation of all the tissue. Understand that the treatment of sleep disordered breathing is under the direction of a physician. It's diagnosed by a physician, and it is ultimately their responsibility, but the dentists assist the medical community in treating sleep disordered breathing, especially for our patients that are intolerant to CPAP therapy, that's continuous positive airway pressure. Some of those folks, as well as some folks with mild to moderate obstructive sleep apnea, can seek care from the dentist.
Okay, and how might a patient know that they need to maybe get tested for that? What are some symptoms that they might be having?
Well, the most common symptoms for somebody would be excessive daytime sleepiness. There are certain if you find that you just cannot stay awake at a stoplight or that midday drowsiness, the folks they fall asleep earlier in the evening. There are some other predictors. A lot of people with hypertension, with other cardiovascular disease, they seek the physician. They may be a suspect to it. A lot of physicians will look for other indicators like a high BMI or a body mass index. People that are obese or overweight a lot of times are at higher risk to obstructive sleep apnea. So, seek care from the physician. Physicians will usually then order a sleep test, which will then start the proper health channel on that.
Okay. Now, let's talk about cavities a little bit and maybe how you treat those cavities. Is there any advances in technology? Is it a little easier than it used to be? Let's talk about that.
That's a good question. We are seeing a new rise in tooth decay, and there's a lot of different ways to prevent those cavities, but once a cavity does form, you're seeing some new materials used in treating cavities. The tooth-colored filling materials, the composite filling materials have advanced a long ways. And so we're able to catch a cavity sooner with the advent of digital radiography. And by having cavities treated sooner, less of the tooth breaks down. And so when you're left with a smaller filling, conserving healthy tooth structure, you have a healthier core strength of the tooth. And so that gives the tooth a better long-term prognosis. And so we're not really treating cavities any differently. We're just catching them sooner using some more advanced materials than the older silver filling materials. And so it has come a long way, that's for sure.
The advent, the white-colored materials that a lot of dentists are using today, it's really become the state of the art. Dr. Johnson mentioned we're able to actually etch or prepare the tooth and actually get a bond between the restoration or the filling material or even the crown and the tooth. Now, back in the day when we placed silver fillings, we didn't really get that kind of an adhesion. And so what would happen is right at that edge, it would actually corrode a bit and we'd still get a seal. So the technology has come a long way, but he's spot on. When you have a conservative small filling, the shorter the filling, the longer its lifespan, and the more healthy it is, more conservation of tooth structure it is for the tooth. So the advances in early detection, especially with regular care from our patients and regular visits from the dentist, has really helped us to be able to conserve teeth and preserve their health for a lot longer.
And you mentioned prevention. Besides the brushing and the flossing, what are some other things a person can do to prevent those cavities from happening?
When kids and adults come in to get their teeth cleaned, there are fluoride varnish treatments available. And fluoride helps re-strengthen damaged tooth enamel. It also makes it tougher for plaque to adhere to the teeth. And so if it takes good experience and good ability of the patient to receive that care. And so a lot of it boils down to a patient's carries risk factors. You know, are they at risk for cavities? Is they're controlling their sugar intake, and really just staying dialed in with their home care, that's for sure.
And what about children with their baby teeth? Is there a danger if a parent just doesn't think they need to, since they're going to fall out? Is there a danger in not having those cavities filled or capped?
Probably one of the most important rules for baby teeth is to conserve space for the adult teeth. And so if primary teeth or baby teeth form tooth decay at an early age and those teeth are removed, there'll be a lot of crowding and orthodontic issues created. And so sometimes parents don't quite understand why we're going to invest in a primary tooth that may only be kept for another 2 years, 3 years, but its role is to maintain space for that adult tooth to come in.
Okay. What about a receding gum line? Is there anything that can be done for that?
Receding gum lines most often are a result of over-aggressive brushing or brushes, actually the actual mechanical brushes that have medium or stiff bristles to them. We highly recommend a technique that you can brush up with, no pun intended, with the hygienist to adapt the brush and the bristles to the brush to the teeth and the gum tissues at certain angles, and use certain motions that are less physically traumatizing to the gum tissues. Because once that tissue is traumatized, understand that once the gums have receded, underneath that the bone has receded also, the supporting bone for the tooth. And so it's very difficult to recapture that. Now we certainly can recapture some of that height with certain surgical procedures and such, but generally speaking, once it's receded, it's really where it is. And of course, then once the gums are receded, they come off of the enamel of the tooth, and the portion of the tooth underneath the cementum is exposed, and this can increase sensitivity. Increased sensitivity makes it more difficult to brush. You end up with a catch-22. Patients don't want to brush quite as well. They're not as diligent. So most of the receded gum line issues that we've run into in our practice are mechanically oriented.
Another contributing factor to receding gums can be TMJ issues. Clenching and grinding can cause that also, and sometimes, in addition to the tooth brushing, acid erosion. We see that fairly commonly with patients with acid reflux disease, and their TMJ dysfunction can produce that concavity or fraction at the gum line that patients can feel with their fingernail. It can be sensitive to cold. It can be sensitive when they brush. So there's a lot of factors that can go into that.
What age is recommended for wisdom teeth removal?
Ideally between age 17 and 21. At that point in time, the wisdom tooth has partial development of its root system, not all of it. And we remove wisdom teeth to prevent future damage to second molars. We want to protect those second molars, and very few wisdom teeth can be cleaned properly 360 degrees around the tooth. And so that corridor between 17 to 21 is ideal because the teeth can be removed with the least number of complications.
And what kind of complications can there be?
Complications from wisdom teeth most commonly involve pain. The depending upon how the wisdom tooth presents or is in the jawbone and its relationship to the second molars, as the doctor mentioned, can also lead to inflammation and or infection around those. We can get cystic formation, or a cyst can form around these wisdom teeth. The problem with wisdom teeth is that the older we get, not only do we tolerate or can we handle injuries at a lower rate, you know, it's just harder on us the older we get. But if we can catch those wisdom teeth right through that window of time, the removal thereof is more atraumatic. It's not nearly as tough on the patient. But those are the most common presentations: infections, inflammation around them, the teeth called a pericoronitis, a cystic formation or pain, or as we mentioned, you know, those wisdom teeth. If you talk to the orthodontic community, they like to see those wisdom teeth taken care of. A lot of times they feel like those impacted wisdom teeth can have an untoward effect on the finished orthodontic case as they finish it up. So there's a number of different things that the wisdom teeth can do for us.
Okay. What percentage of patients need their wisdom teeth out?
I'd say, I just spoke with an oral surgeon yesterday about this, and I said, what percentage do function well? And in studies, it's about 15% or less actually have adequate room for the teeth to be of function, of chewing benefit. And they're a long ways back there. And when you look at them, they need to be able to clean those properly, and we need to be able to treat them too should they form a cavity. And so they're a long ways in the back of the mouth. Yeah.
There is a racial component to that. Some people are African American patients. A lot of times they have a larger maxillary and mandible, and so a lot of times they'll be able to accommodate third molars. But as he's pointed out, it's strictly a space discrepancy issue. If they can't fit in there, then they can't accommodate them.
Sometimes I still try to figure out why we even have wisdom teeth. Okay, well,
That's right.
how safe are dental x-rays, and are they necessary at each visit that you take to the dentist?
Dental x-rays are very safe. With the advent of digital radiography, we can acquire diagnostic images with significantly less radiation, at least half the radiation that was required with traditional films. As far as who needs what x-ray and when, that kind of determines on the person's oral health. Somebody that's at a high tooth decay risk might need checkup x-rays every 6 months, whereas somebody that's never had a cavity in the last 5 to 10 years and doesn't have any early signs of tooth decay or any areas of concern might be able to go 18 months to 24 months. But it really depends on the person's oral health. And I'd say probably the coolest thing about digital radiographs is the ability to share that information with the patient, to be able to put that information up on a computer screen and show them, see that dark triangle right there? That's what it looks like in the mouth. And so I think those radiographs have helped a lot with sharing that information with patients and getting them involved in treatment.
And we just have a little bit of time left, and we have a caller on the line, so we're going to go straight to the phone lines. This is Dixie from Osborne. Go ahead with your question for the doctors tonight.
Yes, I have tori, and I have had 2 removed, and I have another one about the size of a large pea, and I'm just wondering why, and could you explain a little bit about it?
Dixie, that's a great question. What Dixie's referring to, there are tori, which are deposits of extra bone that can form either on the roof of the mouth, Dixie, or within the lower jaw. Where are you getting those? Okay. Sometimes the body can lay down extra deposits of bone. Sometimes that is in response to occlusal factors such as clenching and grinding. They can be a nuisance because, I imagine when you have x-rays taken at the dentist, the sensor can kind of intrude on those areas. The tissue can be tender in those areas too, and so if it's interfering with a prosthesis like a denture, a lot of times the dentist will want those removed to clear space for the insertion access of the prosthesis. And so having them removed isn't a whole lot of fun, but it can help a lot with the success of a prosthesis or patient comfort.
Okay. Well, our thanks goes out to Dr. Dan Winter from Manhattan and also Dr. Eric Johnson from Topeka for being our guest tonight on Doctors on Call. On our next Doctors on Call, we'll be discussing podiatry. You can email us your questions to us for our next program at doctors@shptv.org or tweet us at #.call. We want to thank our doctors for coming this evening. Thank you for joining us for Doctors on Call. I'm Jenna Miller.
Doctors on Call is made possible in part by an underwriting grant from Kansas Medical Mutual Insurance Company, developing and offering insurance protection and services for the medical community in Kansas. Working with Kansas Medical Society, the Kansas Hospital Association, and local communities, KAMCO supports the practice of medicine.
Blue Cross and Blue Shield of Kansas, serving more than 870,000 Kansans in various programs. Value Kansans Trust. Blue Cross and Blue Shield of Kansas, an independent licensee of the Blue Cross and Blue Shield Association.